If simple activities are leaving you out of breath, you may want to reconsider the reason why. The fact is, it could be COPD. And joining me to discuss is Candice Norris, who lives with the disease, along with Dr. David Menino, U.S. respiratory expert at GSK. Thank you both so much for joining me.
Thank you, Alex.
Dr. Menino, starting with you, why is it that COPD patients don't open up about their symptoms, or potential COPD patients?
Well, I think there are multiple reasons for this. For example, in the state of Arizona, over 6% of adults have diagnosis of COPD, which works out to about 340,000 adults. But there are many more who may have it but have not had a diagnosis. And the reasons for this is they may not realize that the symptoms they're having are COPD. While it may be obvious for symptoms such as wheeze or cough or coughing up phlegm, sometimes being short of air when climbing upstairs or just being fatigued all the time is something that patients may not relate to COPD. Patients might be embarrassed by these symptoms. If they've been a smoker, for example, they may feel that this is something that they brought on themselves, and they may be embarrassed by it.
And determining how to manage the disease, it's very important to know the severity of it, right?
Absolutely, because if one looks at the management strategies for COPD, the more the clinician understands about the symptoms that the patient is having, and also the risk that they have for future exacerbation events, that sort of guides some of the specific drug-related therapy. But also there are other therapies, such as stopping smoking if they're still smoking, having an exercise program, having an appropriate diet, and appropriate vaccinations.
And Candice, like I mentioned, you live with COPD, and the fact is it's actually taken hold of your family in a big way, right?
Yes, it has.
Tell us a little bit about your story.
Well, it was diagnosed in 1996, and I lived with it for many years before taking it seriously. It affects not just you, it does affect your family. You want to be there for them, and you can't be when you're in the middle of a flare. It's something that you're going to always have, but you can control it. You can lessen the severity. You can develop an exercise program that works for you. My family has helped me with that a great deal, and I'm always on the go, and I feel great, and it's because of the processes that I've gone through with my doctor, my family, and my exercise program to keep going like that.
I'm so glad to hear that you're managing it successfully. So how would you describe the symptoms to somebody, and what would you tell them to take it seriously?
Well, the symptoms can be very serious. When you're involved in the severe shortness of breath, it's like trying to inflate a brick, which I'm sure sounds like it's almost impossible. That's when you really do need help. You need to let your doctor know. You need to let your family know. That's probably the time when you absolutely should be in the hospital. And it's critical at that point. You can live with this condition, but you must take care of it. You have to manage it. You cannot let it manage you.
Right. You can't just let it be. And doctor, what advice would you have for somebody to get that conversation started, and also to get more information about it and get well educated?
I think a well-informed patient is one that's going to do the best. I recommend the website of the COPD Foundation, which is copdfoundation.org. That provides information for not only patients but also physicians and caretakers of the patients, because the ultimate goal is to not only add more years to the life of the COPD patient, but to add more life to their years so they can do the graduations and the weddings and the vacations that are important to them.
Well, very good point, doctor. Thank you so much for the information. Candice, of course, for opening up with your story.
Thank you, Alex.
Thanks, Alex.
Stay where you are. We'll be right back.